Hey folks, Dr. McCarthy here, and I want to welcome you to tonight's Thursday night workshop. This is obviously the last one we're doing this year, but this one is here in preparation of what's to come next week and the beginning of the year. Obviously, folks know that at the end of the year, you start thinking about what your resolutions are going to be for the coming year. And probably the number one resolution that people say that they're going to embark upon is they're going to lose weight. I'm going to lose 20 pounds. I'm going to lose 40 pounds. I'm going to get in shape. I'm going to lose weight. And the problem is that there are so many gimmicks and tricks out there on the market that people fall prey to, and a lot of these things will work to the extent that you can lose 20 pounds. But then when you stop doing it, you gain all your weight back. We have a unique approach that we work with here in the office, and it's unique in that it's a neuro-metabolic approach. And if you deal with folks from a neurological perspective and a metabolic perspective, that's when you can have truly life-changing impact. When you just simply take some kind of gimmick pill that makes your body burn weight and you stop taking the pill, you're going to go back to your same unhealthy eating habits. Our metabolic approach is very unique. There's nobody around who's doing stuff like this, but we get some really fantastic results. So we're going to talk a little bit about that tonight. We put out a whole bunch of different types of DVDs here according to some of the patients that we typically see here in the office. We see a lot of people who are dealing with peripheral neuropathy, the numbness, the burning, the tingling in the hands or in the feet. We have a ton of people who are dealing with thyroid disease or Hashimoto's. We just had, half an hour or so ago, another patient who we told, actually, ma'am, you've got Hashimoto's. And she said, well, why did my doctor never tell me that? Well, because your doctor never ran the right test. If you think back to a couple of weeks ago when we did the thyroid workshop, all the tests that need to be run, if you don't run the right tests, you're never going to get the proper answers. So, it's disheartening, but the good news is we are here for you. Next, breakthrough treatments for fibromyalgia. We've got dozens of patients currently who walk in here diagnosed with fibromyalgia, and I'm going to tell you that every single one of them has different things that are causing their fibromyalgia symptoms. So, just because you have a label hanging around your neck doesn't mean that there's some kind of disease that jumped inside of you. It's a combination of many different factors. And this is just a classic example of neurometabolic. Actually, all of these, peripheral neuropathy, thyroid, and fibromyalgia, are all neurometabolic. As well, people dealing with chronic health problems. That can be a big part of healthcare in this country. We have a great healthcare system when it comes to dealing with acute issues like broken bones and heart attacks and strokes. But when you're dealing with chronic problems like heart disease and cancer and diabetes, we don't do such a good job. And our approach is very different. We manage people who are dealing with chronic neurological and metabolic conditions. So, if anybody has any more questions on any of these things, feel free to give us a call and we can share our approach. I have a ton of stuff right here on Facebook, on our websites, and on our YouTube channel. I've got probably close to 200 videos, and there's just, there's more coming. So when we're done here tonight, again, I'm gonna, as usual, post this video right here on our timeline, and then if folks have questions, you can ask underneath. Most people, when it comes to weight loss, they think that you have to do some kind of starvation diet. I'm going to starve myself. Well, I'm going to tell you that is not only not going to work, it's actually very dangerous. You cannot starve yourself. In order to burn calories, you need to put fuel into the machine. You got to put gas in your car, you got to put calories in your body. The issue is you got to find the right calories to put in your body. And it's not the same for everybody. There's different types of diets, and we'll utilize different blends and mixtures. We use anti-inflammatory diets. We use autoimmune type protocols. Some folks, we use ketogenic diets. So it's different for everyone according to their specific instances. And that's why we need to take a look at people from a neurological standpoint and from a metabolic standpoint to figure out what's going to be the best approach for you. But if you don't ask the right questions, you're not going to get the right answers. We do ask the right questions. So when we can figure out, what are your goals, what are your ailments, what are some medications you're taking. There's a ton of medications that are out there that are contributing to people not being able to lose weight. And, I would never tell anyone, it's against the law for me to do that. I would never tell anyone, well, stop taking your medicine, then you can lose weight. That's silly. But it's important that you understand that that's a contributing factor, all right? I don't want to tell people to stop taking their medicine. I want to fix people and get them healthy so that they can go back to their doctor and say, hey, doc, can I get off of this medicine? And, that makes me happy when people get healthy enough that they're able to throw away a prescription. That's what wakes me up in the morning. So depending upon which type of diet we utilize, it helps us to determine what kind of results we're going to expect. And if it's, say, somebody wants to lose 20 pounds, there's simple, easy ways that we can do that. We have folks here that'll lose 20 pounds inside of a month, but you got to do it the right way. If you can find out, we talked about last week, we talked about gluten and how that has an impact on your weight. Well, there's lots of other foods too, like we touched on, the casein, the soy, and the corn, and many different types of cross-reactive foods that can be contributing to your weight. So if you take these foods away, weight loss can be dramatic, because people don't even realize that if you eat a little bit of that food every day, that it has contributed to your ill health. It's not like you eat the food and you feel horrible like that. It's you just keep eating the food and it keeps packing the weight on and making it impossible. Another piece of the puzzle is thyroid function. And if you have a thyroid that's gone sluggish, hypothyroid, or if you're dealing like with Hashimoto's, which is the #1 cause of hypothyroid, that can slow down your thyroid to the point where you don't have enough thyroid hormone, and that slows your body's metabolism down. So you can start, doing all kinds of crazy diets, a water diet, a grapefruit diet, and you can pick all kinds of diets. But if your thyroid's not humming, you're not going to lose any weight. And, it's not going to last, at least. So, we need to evaluate thyroid function as well. So my point in tonight's video is, next week we're going to do an in-office workshop on weight loss programs, and we're going to talk about the natural, safe way to do it. So tonight we're just trying to pique interest and see who has questions. Weight loss is just a controversial topic. Well, we've been working with this for well over 10 years now with the Metabolic Approach, and there's just nothing better. We don't use any drugs, we don't use any surgeries, we don't put any balloons down your stomach, we don't sew up any organs, We're going to find out what's right for you. And if you can find out what's right for you, not only are you going to lose weight, but you're actually going to get healthy. And that's really what we're about. We're trying to find the right diet to make you healthy. And as you get healthy, losing weight becomes easy. It's kind of like losing weight is a side effect of the approach that we use here in the office. And folks are psyched. There was a patient came in today. I haven't seen her in a month. She missed one appointment because she was out of town 2 weeks ago. And in the past month, she's down about 15 pounds, and she's just tickled. She's like, I didn't know I was going to lose weight. She's not here to lose weight, but she's following an anti-inflammatory diet. The side effect is she's lost about 15, maybe even 20 pounds over the past month. So that wasn't our goal, but that's a nice side effect, isn't it? So again, when folks come in here and they say, hey, I just want to lose weight, we've got a couple of different systems, a couple of different ways to do it. We just got to figure out what's right for you. So again, I'm going to have you just post your questions underneath, or feel free to call me and I'll edit this video and get it back up again. Feel free to call me here at the office. It's 252-758-2222, and I'll see you in the new year. Thanks.